With all that has happened over the past year, healthcare workers and organizations have felt the need for information technology like never before. The pandemic has emphasized the need for automation in healthcare organizations. Yet there are many challenges faced by the healthcare and IT industry. Also, many patients are not fully engaged in digital healthcare and remain unaware of their services and its benefits. We at Medicircle are presenting to you the Healthcare CIOs and IT Manager series with the eminent IT personnel of healthcare, wherein we are discussing the challenges and the opportunities that healthcare IT shall bring about to the world post COVID. Hi, I'm Smita Kumar, and in this series today we have with us Anil Sangalgikar. Anil is the IT manager at Harya LG Rotary Hospital, Vapi. He has also worked with eminent healthcare organizations like AIMS Hospital and Research Center and Lokmanya Medical Research Center in Pune. He's a multi-certified technology professional with experience in managing enterprise implementations of healthcare information and EMR systems. Hello, Anil. Welcome to Medicircle.
Hi.
So to begin with, being a healthcare IT manager yourself, so what are the challenges you have been facing all through these years while working?
Yeah, the major challenges we're facing is the bridging the gap between the software company and the management.
That's
Because that is the basic role of the IT manager
yes,
to implement the proper system with the help of software company and the help of the management,
sure,
and roll out the project with the efficiency and provide the best result to the organization.
sure, sure. Because and there's always a gap between the hospital's requirement
Yes,
and the
yes.
because as you will
Requirement analysis is always there, and always there is a gap, and always we have to be a member to bridging the gap from the both the sides.
yes, yes, definitely. So Anil, like digitalization is like the new mantra today. IT is seeing a paradigm shift right from being a luxurious thing to a necessity. Nowadays,
Yes,
automation in hospitals is very
definitely.
common. We are starting from the billing itself, but yes, at least there is a module which is automated in different hospitals. And then we can move on to different kinds of online consultations and EMRs and patient portals that are still yet to come.
Right.
But yes, it is getting practiced in a lot of hospitals or bigger setups. So, what, according to you, are the basic aspects of IT that are required when it comes to healthcare? That things should be there.
Yeah, basically from the scratch, if we say the one time is there, the IT is the luxury for the healthcare, but nowadays, for the in this pandemic, if we see that IT is a necessity. The
Definitely.
patient sitting at the home, he can consult with the doctor, he can enter the prescription, the patient, the pharmacy will provide the medicine at the doorstep,
Yes.
the taking precautions of this in pandemic situations. It's a really a necessity for the human being in the Indian scenario nowadays. In
Definitely.
the, if I say one example, in the era of 2000, say a radiologist has to come see the patient and do the reporting for that particular, because the DICOM facility is very costly at that time. But nowadays on WhatsApp he will check the images while the technician doing the MRI or CT, and suddenly he will prepare the reports and send across to the patients,
Sure.
and the patient can show the DICOM images throughout the world anywhere he wants. Such
Sure.
a facilities will be now provided by the healthcare IT, so that it will be the best part for the patient services. If we say for the hospital, it is the best part for the patient service.
Definitely. Because the patient is getting the ultimate benefit of digitalization.
Yes,
Earlier
yes,
times, they don't
yes.
need to visit the hospital just to
Yeah,
collect the
the
report.
time will be saved for the reporting purpose and all these things.
Sure. So, Anil, as you might have seen, Y2K at that time, as you mentioned, year 2000. So there were like of
Yes.
I mean, phenomena of Y2K. So from there, so many things have changed in, especially in healthcare
Right.
IT. So now,
Yes, yes, yes. Lot many things.
so as,
Initially, only healthcare will be treated as a healthcare IT will be treated as only billing component.
yes,
Now the interface will become, then the reporting part will be joins. Nowadays, the robotic surgery, the surgeon will just enter the parameters and the surgery will be done by the robots.
yes,
This is the actual achievement of IT in this from Y2K to till date,
definitely,
and it will be definitely helpful for the patients to get a better results and early relief
definitely.
to his uh, whatever the requirement of that particular patients. If we say that cancer patients, he can consult n number of patient doctors while sitting at the home.
Definitely.
Previously, it is not possible. He has to went to the Bombay for Tata Research Cancer Research Center or
Yes,
some other places to consult the taking for second opinions. But nowadays, while sitting at home, he will get the everything. He can send the report, he can send the images and everything.
definitely.
So
So
this is
as
the best achievement of healthcare IT
definitely.
in the span of 20 years.
So as you have seen from like times from Y2K to now, as in many things
Yes,
are going physical to now being digital, and there's a new buzzword called phygital.
digitalize.
So,
Right.
how what is your take on that? Like, because lot of things which were like still, I mean, not practiced, like second opinions or online consultations or report collection, all everything EMR on the websites of the hospital portals, appointment
Yes.
booking. So these things are happening.
Yes,
So,
yes,
what
yes,
is
yes.
your take on that?
Basically, the people who are now or nowadays, the education level will be now up, and everybody having a mobile, smartphone. So now the people are taking advantage of that and using the digitization of the healthcare IT. But still, if we say the MRD part component is still lacking behind in the Indian scenario for the digitization.
Yes.
And if we say the reports, the patients doesn't have the they never keep the reports with them. In that scenario, they can get the easy reports with the help of the digitization. Like if we use a digitized locker to
Yes.
keep our licenses and all these things, such a kind they can store the reports and show anywhere wherever they want.
Sure.
There is no need to carry on the all whole files along with them to the consultant and all this stuff.
I think also government of
But
India.
still, it will take a time in the Indian scenario to people to use like a digilockers. If
Yes.
we see the digilockers comes 5 years back, but now the utilization of digilockers is improved in current 2 years. Such
Yes.
a things will be taken place in the healthcare IT also. In the next few years, we see that every patient will show the mobile, sir, this is my reports. Whatever you want, just give your opinion.
Definitely. So I
Or
think
still
even
he can
government
send
of
the
India
report.
is
Yeah.
working hard on that because there is a lot of like the National Health Data Mission is there and the sandbox is getting implemented. Like we as an HIS company
But
have been given
yeah,
directives to have all those NDHM
yes.
guidelines to be, and the
But
protocol.
as we earlier discussed now, the thing is that there is not a unique platform for the healthcare. If I say the A company is providing HIS, having a different scenario and types of reports, where the B company is providing the different kinds of reports. So the when we come to the uniqueness, it is very difficult to manage the reports in a central platform, and that is the biggest challenge for the digitization, unique digitization of healthcare. Right?
So one question on your healthcare journey, like you have spent so many years in the digitalization and you have seen a lot of phases in this healthcare domain.
Yes,
So how has your experience been?
it's really nice, and I really proud that I am a part of the healthcare team in the hospital. When we say that my doctor says, Anil, due to this surgery, this patient is survived. It is also, we are behind the curtain, but it is also a proud moment for us.
Surely. Definitely.
And that's why I'm continuing the same field for the past 20 years. I got so many things and so many opportunities apart from that, but still I am in the healthcare, because when a certain we saw the happiness on the patient's face, it will give them more courage to work on and work in the healthcare field.
Yes. So the satisfaction that it provides is really priceless, and
Yes,
this is
yes,
top satisfaction, because this is really a noble work to help the patients with
right.
conditions. And IT, as an IT enabler, you are ensuring
Yes,
that the best patient care is provided. So thank you so much,
yes.
Anil, for joining us and briefing us on how the global healthcare IT space is experiencing new advancements in healthcare information technology, and also sharing your experiences as a healthcare IT professional. Wish you all the best for your future endeavors in the healthcare
Thank
ecosystem.
you, thank you,
And thank you once again for joining.
thank you.